Buddy, I'm Mark Zinni. Thanks so much for joining us here on the Channel 3 Facebook page as we bring you some very important information over the next half hour or so. We know you have a lot of questions right now about the vaccine. So many people do. We do as well. So starting tonight and all week long from 6:30 until 7, our vaccine team will be here with you each night. We're in this journey with you to answer your questions. It's very, very easy. Submit your questions to us all week long. You can use the Channel 3 app. We also have a phone number posted on the Channel 3 app, or right now you can post a comment below this, and I will be checking it out throughout the next 30 minutes, and I will be bringing it to the doctor, and hopefully we can get you some answers. Again, we're all looking for answers. So speaking of all of this right now, we do want to kick things off tonight with our special guest. Dr. Camelia Lawrence from Hartford HealthCare is joining us right now. Doctor, thank you very much for taking some time tonight to be with us. We certainly appreciate it.
Thank you for having me, Mark.
I know you have got to be overwhelmed lately, but let me start by asking you, I understand you got the vaccine, right? Take me through that process. How did that go?
I did. The vaccine represented hope for me from a personal standpoint as well, because my family was also impacted by the COVID-19. So I got my first shot in December 27th and returned 4 weeks later for the second shot. It was an uneventful experience. I had a little bit of redness and pain at the injection site, which is typical for any vaccine that you received. For the second dose, I had some generalized malaise, which was expected according to the information from the CDC. But within 24 hours, I was back to normal, and I feel great.
Well, that's certainly some good news. You were saying you had some personal experience with COVID in your family. I hope everybody's okay.
Well, unfortunately, I lost my grandfather at the onset of the pandemic, followed by my father-in-law. So my family was definitely severely impacted by the pandemic. So we were very delighted when the vaccine became available. It was a glimmer of hope, some light at the end of the tunnel for us.
I would imagine in your role as a doctor, it's been overwhelming the past year. As we approach a year right now, I can't even believe we're hitting this milestone, and you look back at everything that's gone on, and for you to have been on the front line of it and then to dealt with it personally yourself in such a way, it has to have just been overwhelming at times.
It was. There were days where you wondered, when will this end? It felt as if you felt helpless in some moments, because at the time we didn't have any vaccine. We knew that they were working on it, but we didn't know where the light was at the end of the tunnel. It took an emotional toll, not just on myself, but I'm sure even my peers who had an immediate front row seat to the pandemic, those who were in ICU and were dealing with patients on a day-to-day basis.
I understand, Dr. Lawrence, you are a breast surgeon. Talk a little bit, if you could, about what you do, what your role is.
So I'm a fellowship-trained breast surgeon within Hartford HealthCare. I serve as one of the medical director for the Hospital of Central Connecticut, as well as Mid-State Medical Center. My function is an administrative component, but primarily I'm in the operating room. I take care of women who are diagnosed with breast cancer.
I would imagine this is a time when you can't stress enough. I've talked to people who have put off doctor's appointments. I'm sure you would tell women everywhere right now, please go to the doctor, get your annual checks. Is that correct?
Oh, absolutely. The spaces in which you're entering are very safe. There are protocols that are in place to protect the patients as well as our employees within Hartford HealthCare. There's frequent hand washing, frequent sanitizing of the surface areas utilized by patients. There's crowd avoidance, there's temperature checks. So there's measures in place to keep you safe. Breast cancer is a very treatable disease when caught early, and our screening mammography is the best ammunition that we have available. So I strongly encourage any woman out there that they should definitely go in to get their screening mammogram, because not all breast cancer can be felt. There are some breast cancers that may present as microcalcifications within the breast that you're not going to appreciate on a clinical breast exam or a self-breast exam. And only by getting your mammogram will those abnormalities be identified.
I mean, that's such an important message, because I think in some ways everyone has just kind of stopped living for the past year, and we're all just trying to, socially distance, wear our masks, do what we're being told to do. All of these things are the right things, but we still have to care for ourselves at the same time. We still have to put ourselves first. I believe we've potentially lost Dr. Lawrence. Let's give her just a moment right here. You know, technology these days, it may have froze up for just a second right here. We're obviously dealing with you know, everybody at home is very familiar with what Zoom is and how these things work. So it's no different for us here at a television station many times, actually. So we dial into these signals and kind of bring you live TV that way, on the air during Eyewitness News, and even right here during something like this on Facebook. So I'll take a moment right now to remind everybody as they check on Dr. Lawrence's signal, this is a good opportunity for you to post something here on the Channel 3 Facebook page, leave a comment underneath, let us know if you have a specific question. Obviously, as you just heard right there, Dr. Lawrence is, her specialty involves breast surgery, breast cancer. These are very serious matters, but she is very well versed in the COVID pandemic. And as soon as we get her back, which I'm thinking we may have her back, we're going to start asking her some of your questions. Dr. Lawrence, can you hear me okay?
I think you're muted, Mark.
Okay, I'm muted. They're going to work on that right now. We're going to press a button right here.
Yes.
You can hear me.
It's technology for you.
I know. I was just saying, you know, this is how these things work. It's live TV, live Facebook. It's no big deal at all. So there's nothing to worry about. I often say I'm not saving lives. You're the one doing that, and we cannot thank you enough for what you've been doing.
Yeah. So as I was saying, it's so important for women to come in and have their screening mammogram done because, you know, the later the stage, it does affect the prognosis. So we want to catch breast cancer when it's very small at its earliest stage. That offers the best window, the optimal window for management and treatment.
Very, very good points right there, Doctor. And I have a lot of questions here from people, and I've been encouraging them, including a moment ago, to send in their information or their questions right now on our Twitter. You can also find us on Facebook. And if anyone has a good question, we'll pass it along over the next 20 minutes or so. I was saying your specialty is breast surgery, breast cancer, but you're very well versed in COVID. So Tiffany from Hartford is going to start us off right here. She has a question. She's saying, Doctor, can I stop wearing a mask after taking the full dose?
No, Tiffany, the recommendation is that you continue to wear your mask and continue to adhere to the social distancing protocol and crowd avoidance.
I think that is something we've been hearing a lot lately. I just saw something with Dr. Fauci saying, okay, everybody, I know you want to celebrate when you get that shot. My mom recently got her first shot, and she said she felt like a new person. I said, do not get crazy yet, okay? Just keep doing what you've been doing. And I think that's really the bottom line here, right?
Yeah, absolutely. We must continue. You know, the vaccine does not confer 100% immunity against the virus, and we have not yet achieved what's considered herd immunity. So at this juncture, the recommendation is even after you've completed a 2-dose of vaccination, is that you continue to wear your mask.
Now, Maria from Beacon Falls is asking, if someone has had the virus, how long should they have to wait to get the vaccine?
Well, there's no contraindication to getting the vaccine after you've had the COVID-19 virus. What we do recommend is that you wait until you're at least asymptomatic and you've completed your time that's recommended for quarantine, which could be between 10 to 14 days. If, in fact, you were impacted by the virus and you had the convalescent plasma or any of the monoclonal antibodies, the recommendation is that you wait at least 90 days. We have sufficient evidence to suggest that you have natural immunity from having the virus for at least the first 90 days. So I think you're safe within that window to time period to wait until getting your vaccine.
That's very good information. Someone said here on our Facebook page, they just posted, they're afraid of the shot. Do you hear that from people?
I do. You know, there are a lot of myths and misinformation that has disseminated, especially through social media regarding the vaccination. And that has led to a lot of fear, a lot of anxiety about receiving the shot. The shot is safe, it's efficacious, and it is safe. It went through all the same rigorous FDA protocol as any other vaccine that we've had in this country. And as a physician, I could not wait until I was able to get this vaccine because I knew what it meant for me, what it meant for my community, as well as my family. So nothing to be afraid about with the vaccine.
I know you were talking about, side effects and not having too many yourself personally. Lucy on our Facebook page is saying she's actually very concerned about side effects and isn't exactly sure how to go about handling those. And I also hear myself that when people have the second shot, sometimes the effects may be more severe the second time. Is that true?
Yeah, you can see more of a more severe or a reaction, so to speak. But that's also a positive sign because that means that your body has been able to mount the immune response that we need in order to combat this virus. So you may get a little bit of headache, you may get some nausea has been reported, low-grade temperature has been reported, and diffuse body or joint pain. But in a majority of cases, it subsides within 24 to 48 hours.
Oh, that's certainly good news. I want to pass this along, doctor, because this is very nice. I want to share this with you. A woman named Heather posted on our Facebook page, said, "You are the best. You were her surgeon, and she trusts your knowledge and your experience undoubtedly." So she wanted to make sure people knew that.
Well, that's kind of you, Heather. Thank you very much for that positive remark.
So I have a question from Tina in West Hartford as well. I currently work from home because I am high risk. After I get vaccinated, is it safe for me to go back to work right away?
I think that warrants a discussion with her doctor to see what made her high risk. Because as we mentioned earlier, the vaccine does not give you 100% immunity against a virus. So it would be important to have that discussion to see what is she particularly at risk for, whether it's say what environment would she be returning to, how much exposure she would be having at her job. So I would recommend speaking directly with her physician.
I think that's a very good point. So many of these cases are so specific. It's hard for you, I would imagine, as a doctor to kind of paint it with a broad brush or something like that because it's just not the case for everybody.
Correct. You don't want to generalize, and we do have different factors that make us high risk or not high risk. So it's really important to individualize each patient a presentation.
Now, someone is asking here, a woman named Pat is saying, and this may kind of go along being quite specific and one of those things where it's hard to generalize, but she's saying, how do you feel, doctor, about someone with a fib and clotting problem who's also immunosuppressed? I don't think I'm saying that correctly. I apologize.
Nope, you did.
Immunosuppressed. Okay, good. I'm not a doctor.
You're doing good, Mark.
I get a little nervous when I have to use these big words, doctor, so watch out. Is it okay for people who are dealing with certain specific, I would imagine they have to contact their physician as well, right?
Correct. Yeah. A history or having, being anticoagulated or having atrial fibrillation is not a contraindication to receiving the vaccine. But if you are immunosuppressed and you're currently receiving immunosuppressive therapy, you should have a conversation with your medical oncologist. I know in some places what they're doing is staggering the vaccination in between the cytotoxic doses of your therapy. So they'll schedule you accordingly from a time after your cytotoxic chemotherapy regimen to get the vaccine after, and they time it for the second one when it's due.
Yeah, there are several questions actually from people talking about getting it with autoimmune diseases, a concern as well from a lot of people tonight.
No contraindication for autoimmune disease to get the vaccine. Mm-hmm.
That's good.
Yes, absolutely.
Well, Jimmy from Deep River is saying, if I received the Moderna vaccine for my first dose, is it okay to get the Pfizer vaccine for my second dose?
No, Jimmy. At this point,
yeah.
we do know
Jimmy
that
needs to know
the
this.
vaccines are not interchangeable,
right?
At least not yet. There's no data to suggest that. So if you were vaccinated with Moderna for your first dose, the second dose should be Moderna. Likewise, if the first dose was the Pfizer vaccine, then a second dose should also be the Pfizer vaccine.
And that's partly why, doctor, if I understand correctly, you get this card when you get the shot where they record what you get, and that's so they can make sure you get the second one as well?
Correct. It's accurately documented because we want to be consistent with both doses. We want to make sure that the same dose that you got the first time around, that the second dose is also reflective of the same dose.
We actually had a story the other night here on the news talking about how there are some very early studies that are now looking at possibly mixing these doses, but it's very early and they're obviously not recommending that right now.
Correct. Until that data is fully available and we've vetted the process, in its entirety, the recommendation at this time is to really stick with the dose that you have received for the first one.
Roberta in Middletown is saying, how soon after getting your second vaccine? This is actually a very good question. I think a lot of people ask this. After you get that second shot, how soon are you, not that free and clear is the right way of putting it, but just maybe in a...
You can let your hair down and do everything.
Yes, I'm ready, doctor.
Not yet. We've made progress. I think eventually we'll get to that point. But after you've been vaccinated, the recommendation is really to continue to adhere to the protocols until we've got everybody vaccinated, or at least at 70-85% that's needed for herd immunity. So you should still, practice the social distancing, continue to wear your mask, wash your hands frequently, and the crowd avoidance is also very important.
On that, I want to ask you, because the Super Bowl last night, and you see you see these celebrations happen afterwards, and I'm looking at these players in each other's faces, and obviously there's a lot of testing going on there, but then you look at the celebrations in the street. For you as a doctor, is that incredibly frustrating?
I cringed last night when I saw that. I was very happy in terms that folks had an outlet to celebrate, but I was also very, very uncomfortable watching, because what we do know about how the virus spreads, that's the perfect environment for dissemination of the virus. And I'm sure a lot of those folks that were there, they were much younger, they weren't vaccinated yet. So we will see as the days unfold. Hopefully it's not the case that it will be an outbreak, but we'll see as the day unfolds. It's so important for us to take this serious, take this virus very serious.
Oh, my goodness, without a doubt. And I was going to say, it's interesting because the Super Bowl was also at the same time about honoring healthcare heroes and professionals like yourself, the men and women who have been doing this, as I said before, for a year now. I just can't even imagine what has been going on inside hospitals here in Connecticut and across the country. So we start the game off celebrating and honoring, and then at the same time it ends by almost saying, okay, now we're not going to listen and potentially see a spike, which is the last thing anybody wants to see.
Exactly. So sort of be undoing the progress that we've made. And I think we just have to be very meticulous in reminding the community and our citizens of the importance of adhering to those social distancing protocol and wearing your mask. That's the least, the one small thing that you can do is wear your mask at all times.
We are below 4% now in Connecticut, which is certainly good news from where we were a few weeks ago after the holidays and all that.
Oh, absolutely. We are trending in the right directions, and I commend our citizens within Connecticut. I think Connecticut has done a remarkable job at following the recommendations and really helping to support the healthcare workers who are on the front line and dealing with this on a day-to-day basis.
Yeah, I think a lot of people feel that way. You mentioned masks. Dr. Fauci, again, the other day there was some talk about maybe 2 masks, and you see that. And I'm not going to lie, I actually have 2 right here myself. Sometimes I put 2 on. I don't know if that's right or wrong. Maybe it's silly. I just feel like in certain environments, you go to the grocery store, things like that, maybe it's better. Does it make a difference?
I think it's an additional layer of protection,
Right.
Especially if you're wearing those cloth masks. There's some discussion that 2 is better than 1. I have no objections to it. I think at the end of the day, safety is the most important. It's best to at least have 1, but if you have 2 and you can get an additional layer of protection, why not?
I also think a part of it for people is that they should feel comfortable to do, we want everyone to follow the rules, for lack of a better word, and wear the masks and socially distance. But, some people are more serious about it than others. And it's just one of those things where everyone, in some ways, if they have to take it to another level to feel comfortable for themselves, then maybe that's okay.
Yes, absolutely. I'll use my dad as an example, who wears his mask around at home in the house.
He's like, hey, my daughter's a doctor. I need my mask on.
Exactly. He's doing everything he can to protect himself.
He's very, very smart. Teresa from Danbury is saying, if I do not belong to the Hartford HealthCare network, can I still register with them to get the vaccine?
Yes, absolutely, Teresa. If you're within the category in which the vaccine is being disseminated to your group, you can. If you log onto the Hartford HealthCare website at hartfordhealthcare.org, on the landing page, there's specific directions that will guide you to setting up a MyChart Plus or logging in, where you can register for the vaccine. Alternatively, if you do not have access to a computer or you're not computer savvy, you can contact the Hartford Healthcare Access Center, and that number is 860-827-7690. Again, that's 860-827-7690.
7690. I'm jotting that down. I'll make sure we post that online as well for people at home. I know we've said it a few times on the air, but it never hurts to make sure people have this information as much as possible. Kathy is asking on Facebook, I am due to get my second Moderna vaccine on Thursday. My vitamin is low. I'm wondering if she's meaning vitamin D, because she's saying she's taking 50K once a week for 12 weeks. Does that make sense? Maybe she doesn't have enough information here. She's asking if she thinks she could get sick from the vaccine if her vitamin levels are low. But that's all.
No, not at all.
Okay.
No, it should not be an issue.
Okay.
Yeah.
That's good news. That's good news. All right. Cindy in Trumbull, do we know how long this vaccine will last?
Well, that's a million-dollar question. We don't know exactly. We think it's about a year that we will definitely have some immunity from the vaccine, but that information is still being studied to see how long our immunity will last after the vaccination.
Rosa is asking on Facebook, and I've actually read of some instances of this. Can you get the virus after you've been vaccinated?
You can, yes. It's very rare, but it has been reported that you can get the virus after the vaccine. Remember, the vaccine gives us about a 95% efficacy. So there is a window there where you could get the virus. But the good news is that if you're fully vaccinated and you do get the virus, the probability of you dying for the virus is almost next to zero. So that's the importance of getting the vaccination, is that it doesn't necessarily 100% prevent you from getting the virus, but should you get the virus, it's unlikely that you will die from this. And that's the point that we really need to drive home, is that we've had enough losses, we've had enough deaths from the COVID-19 virus. And what we're trying to do is to mitigate our losses at this point. So by being vaccinated, should you get the virus, chances are you'll very much be around with us even after they get in the virus. Because your body will be able to mount an immune response.
That is so nice to hear after everything that's gone on. You think of where we've come in a year, it's just incredible. I want to ask you about this Johnson & Johnson shot, because when it came out last week, so many people focused on, okay, so they say 95% for Pfizer, whatever the numbers are, they're really high. And then you hear this J&J shot, not as high. And then you hear people say, I don't want that one. I'm going to tell them I want the Pfizer one. The Johnson & Johnson shot is still a good shot, right?
It is. It's still a good shot. There are many advantages to it. It's a single shot. When you look at the study, the preliminary data that was released, those who were vaccinated, no one died in the group that received the vaccination.
That's very good.
So while it's not as efficacious as the Pfizer or the Moderna vaccine, and it only had an efficacy, I think, of about 6%, when you look at the overall group of those with severe illness that got that vaccine, nobody died. So they were able to recuperate from the virus.
Another thing I think that's kind of interesting, and this goes along, PJ from Coventry is asking, if you've had both Pfizer vaccines, can you still carry the virus and pass it on? So people, and correct me if I'm wrong, please, you can still have the virus even if you've been vaccinated, true?
Correct. You can carry the virus, you can be completely asymptomatic, and you can communicate it to someone else. And hence the recommendation that you should still continue to wear your mask and still social distance, because you could be an asymptomatic carrier.
Very good to keep that in mind, because that, again, goes along with what you've been saying repeatedly. Keep your social distancing, wear those masks, even if you've been vaccinated, because especially right now, not a lot of people have been vaccinated. They're still working very hard to bring those numbers up. So we need to reach that point where it's better for everybody, right?
Correct. The last I checked, I think we were about 15%, right? We're hoping to get as high as 85%. I saw an article a couple weeks ago. Dr. Fauci was saying that in order for us to achieve herd immunity, we're looking at about 70 to 85% of Americans being vaccinated. So we've got a lot of work to do.
Couple quick questions before we let you go, Doctor. Jay in Danbury is saying, can you take the vaccine on an empty stomach? Do you have to take it on an empty stomach, or maybe it doesn't even matter?
It doesn't matter. In fact, I had a hearty lunch before I had my vaccine.
Ready to go for the day.
Right.
Robert in South Windsor, I got a flu shot a week ago. How long do I have to wait for my vaccine?
The recommendation, Robert, is that you wait for at least 14 days before getting your COVID-19 vaccine.
Okay. Paul, we answered your question talking about transmitting it even after you have the vaccine. Deb in Meriden is asking, when will we know if any of the vaccines are truly effective at preventing community spread of the virus?
It's hard to say. I know there's research underway. That's a question that many of our infectious disease experts are looking into, but we don't know yet. More to come on that, hopefully within the near future.
You know, a lot of people talk about having allergies and different things as well, doctor. Those kinds of things, seasonal allergies, none of that can be impacted by this vaccine, right?
Not at all. Seasonal allergy, pollen, food allergy, bee sting allergy, those are not contraindication to receiving the vaccine. What I will say is if you've had those allergies, when you do go in for your vaccination, you will most likely be asked to wait around for at least 15 to 30 minutes for an observation period. But definitely you should still present for your vaccine.
Doctor, what do you say to people in certain communities, some minority communities who, are hesitant to get the shot, talk about not trusting it, things like that? I'm imagining that it's very hard for some people. What do you say to them?
I think an individualized conversation, really exploring what their fears and concerns are, is perhaps the best approach. I have been really just being open about it in terms of why do especially communities of color have distrust this vaccine. There's a long history of, being in the backseat in terms of treatment for healthcare as well as abuse in the name of science. So I do understand why there may be hesitation. And my job as a physician is really to impress upon them. It's a new day, the value and importance of the vaccine, and help to dispel some of those myths that are out there. You'd be amazed at what's floating around on the internet that has led to some of the doubts and concern. And I think once I share that I've had the vaccine, that my close family members, both my parents are on the front lines as well. They've also, been encouraged to get the vaccine. My mom is already vaccinated. Sharing personal stories, and for them to see somebody that looks like them. I often say representation matters. That I've had the vaccine. If I had any concern at all, I certainly wouldn't have been one of the ones, in the front of the line, getting the vaccine. So really just exploring those concerns and disbelief and mistrust and helping to break those walls down.
I mean, this is something none of us have ever lived through. And it's one of those things where now we're better off getting this vaccine than you are getting COVID, right?
Oh, absolutely. It's in everything in life, it's a risk benefit. You risk not taking the vaccine and you risk dying. I mean, we've lost over 400,000 Americans to the virus again already. And we need to stop the carnage, so in one way to do so is by getting the vaccine. The communities of colors have been disproportionately impacted, in part because they represent a lot of the frontline workers. So they're even at higher exposure rates. So it's so important that they are vaccinated, that they get some immunity to guard themselves against this virus.
Well, Dr. Camelia Lawrence, before we let you go, I think the bottom line here, your message is get the shot, do what you need to do to help yourself and your neighbors.
Absolutely. Do not waste your shot. It's so important. We all can play a role, not just for ourselves, but for our family as well as our community at large.
Okay. Dr. Camelia Lawrence from Hartford HealthCare, thank you. My goodness, we can't thank you enough for taking this half hour to be with us right here on Facebook. And so many people are commenting and appreciate everything that you're sharing with us. And I want to thank you on behalf of all of us here at Channel 3 for all you are doing and all of your coworkers there in the system, because it is just tremendous what has taken place over the past year with you all fighting it on the front line.
Thank you, Mark. It's been an honor and a pleasure to be with you this evening.
Thank you, Doctor. Take care.
Bye.